Right, karibu sana. This is Morning Cafe. I'm usually Stanley Nyeringeti. It's a Monday. This particular time discussing matters first aid and giving you the tips that you need to know around your workplace, around pale kwa nyumba, around wherever you are, the kind of things that you need to know. Mtu akianguka pale chini, for example, akona heart attack ama stroke, what do you do? They have an eye injury, what do you do? Also, this particular morning we tell you, you always see a first aid kit. Either you probably have it in your car or somewhere. What is needed in this particular first aid kit? That is the conversation that we're going to be having this morning with Andrew Wanjohi kutoka St. John. Karibu sana.
Shukran.
Oh yes.
Yes.
First of all, much as I know, these are things that we've discussed for for a while.
Yes.
Just you telling us this is what we need to know. Tukianza tuna heart attack,
yes,
as well as even stroke. What do we need to know when it comes to the kind of first aid on the same?
Sawa. Now, thank you. When it comes to a heart attack or any medical conditions, what we'd like, when we are training guys on these medical conditions, we like to first define what the condition is, then what are some of the causes that would cause this, how to recognize a person who is going into whatever medical condition, if it is a heart attack, if it is a stroke, and basically how to manage it. That's the process by which we go by. So when you talk about a heart attack is where the heart, a part of the heart is not receiving enough oxygen. Why? Because of a blood clot. That blood clot now is causing that part not to get oxygen, so it's dying. And that is what the very definition of a heart attack is. So what are some of the causes of a heart attack? Some of the causes, apart from the now with the blood clot, some of the risk factors include the elderly are the ones who are prone to getting a heart attack. Now beyond that, it's also in terms of lifestyle. What kind of activities do you engage in terms of exercise? Do you engage in exercise and such? Do the intake of drugs and alcohol? That's also a contributing factor to someone having a heart attack. And of course, now there are the natural processes or conditions where someone has a heart condition. Maybe they were born with it, or they got an injury that affected the way the heart functions. So those are the guys who are prone to having a heart attack. So those are some of the things that we look out for. And when you do want to now recognize someone who is going into a heart attack, on observation, it's not very dramatic. Sometimes unaweza ona kwa movie ati jamaa tu collapse. It's actually not very dramatic. We find someone has pain in their chest. And the kind of pain that we are talking about is a crushing pain. Think of a very heavy object on your chest, or like an elephant on your chest. That is the kind of pain that someone feels. And they have shortness of breath. Shortness of breath ni ile anajaribu kupumua but haitoki vile inafaa kutoka. And they sweat profusely. They start sweating profusely and the body goes weak. Ana collapse tu pole pole. So it's just a process yenye unapata sasa, then they collapse kabisa. So once you recognize that, the person, the casualty tells you they have a crushing pain in their chest, they are sweating, you find that their lips are even turning blue. We call that cyanosis. That's an indicator that there is not enough oxygen is getting around, and especially in the heart. If the pain is in the heart, that is now someone who is possibly having a heart attack.
A heart attack.
Yes.
So before we get into the first aid,
yes,
that you administer to them, what's the difference now? Because for the heart attack, you've described it, and for the stroke, how different is it with the heart attack?
Now, a heart attack is, or rather, a stroke is the same thing that happens in a heart attack, but now in a different part of the body.
Okay.
That happens now in the brain.
All right.
Yes. So a stroke is a part of the brain not receiving enough oxygen because of a blood clot or bleeding in the brain. So that's basically how we define what a stroke is. It's just the location is different, the cause is the same. Yes. Yeah.
So does that mean now first aid would be similar in some stages?
The most important aspect in the process of first aid is the recognition, either of a stroke or of a heart attack. That is the most important bit, because these conditions, when they develop, if you're suspecting someone has a heart attack, your primary concern is getting them to a hospital. Same with a stroke. Your primary concern is getting this person to a medical facility, because that is where they can sort it out, because it needs drug intervention and basically a healthcare professional to manage it and manage it correctly. In terms of first aid, that's the best thing that you can do for your casualty. Yes.
Right. So at the end of the day, so first of all, just even to remind us, so there's the whole recognition. So what kind of steps, even to someone who doesn't understand the ABCs of first aid?
Yes.
What do I need to know when I see whatever you've described to us? What do I need to know and to do?
Exactly. Now, let's start with a heart attack. We've already described the signs and symptoms of a heart attack.
Yeah.
The pain in the chest, the sweating, weakness, shortness of breath, all that. Once you recognize that, suspect that the person is having a heart attack, call for help. That's the first thing. Call for help. Like our emergency numbers, we've been sharing them all the time. You can even call St. John Ambulance, call for help. That's the first thing, because this person needs to go to a hospital. Now, the next thing about a heart attack is try to get them to rest. Probably it was triggered by something. Stress, it was triggered by excitement, it was triggered by, it just came about. So what we want to do is ease the strain on the heart. The heart is a muscle. So you want to ease the strain on the heart so that they can rest, and the blood, whatever blood it requires, it does not ask for more oxygen, because if the heart is strained, it will be asking for more oxygen. That's what you're trying to avoid, because it's not receiving enough oxygen already. So rest the casualty. And then many times you find that a person who may be suffering from a heart attack may have had previous experience with it. So they may be on medication. One of the major causes also of a heart attack is high blood pressure, both of stroke and a heart attack. So they may be having medication. So what you as a first aider can do is also assist them to take their medication.
So because you told us this person has collapsed and is lying down.
Yes.
So as I come, because I've seen this numerous times, probably qua town and just in public places where someone has collapsed. And the first thing people would be doing is lifting this person up again. Is that the right thing to do, or just have them lie down first and start assessing them? What do you do in this case?
The process of first aid is primary assessment, secondary assessment. In your primary assessment is the doctor ABC: danger, response, airway, breathing, circulation. Is your casualty responding? Highly likely, if it has just started, their casualty is responding. Maybe they have difficulty in speaking, but they are responding. Is the airway clear? If they're speaking, the airway is clear, breathing is present. What you're having trouble is with the circulation. So what you want to do is, if they've collapsed, just leave them on the floor. Help them rest. Let them rest. Ensure that you loosen any tight clothing to ensure proper circulation of blood. If they're unresponsive, we place them in the recovery position. That's basically it. If they're responding in terms of they're still talking and they're able to understand what you're doing, and you can ask them whether they have any medication for it. There's a process we call sample. Sample stands for symptoms. What are the symptoms that they are experiencing? Are they allergic to anything? Medication. Do they have any medication for that condition, or any condition that they may be suffering from? Pertinent or past medical history. Has this ever happened to them before? And if not, is there any other medical condition that you would associate with it? That is the P. Then the L is for last meal. When did you last eat? Sometimes the last meal is, or the last oral intake helps a first aider to know and understand if whatever they took by mouth is affecting them or anything. And then
labda kuna njaa tu.
Ama labda akona njaa, exactly. Labda amecollapse kwa sababu akona low blood sugar.
Okay.
So and then event history. What were you doing just before this happened? Do you remember before you collapsed? Nini ilikuwa was it a high stress situation? What basically was? What are the triggers?
Right.
So those are the things in your secondary assessment of your casualty. Just ask those questions. That helps you to understand what may be wrong with your casualty.
For both the heart attack as well as the stroke.
Yes. Now for a stroke,
Okay.
The recognition is a bit different.
Okay.
The recognition for a stroke, there is something we call the FAST test. The FAST test, the FAST.
Okay.
F is for facial droop. In terms of facial droop, you are going to ask your casualty, can you smile? So for you, naweza kwambia hebu smile. So unaona saka smile yako iko poa, si ndio? But someone who is having a stroke, they'll be droopy. Their face will be droopy on one side. Kuna itakuwa pande moja imelegea. They won't be able to fully smile.
All right.
Then you test their arms. Takwambia, please raise up your arms. Nitainua tu mkono zako. When I raise your arms, niachilie, I will see one hand go down. Ingine itabaki. So there's that arm weakness or arm drift.
Right.
And then I test your speech. I just ask you a simple question to see whether your brain is able to understand what I'm saying. Hata naweza kupatia, naweza kuambia, Stan, ebu repeat after me, she sells seashells at the seashore.
She sells,
Ama, something as simple as, tell me your full name. If you're able to tell me your full name correct, bila slurring your words, then you're okay. But someone who is developing a stroke has slurred speech as compared to previously their normal speech.
Okay.
So atavuta tu my name, atajaribu kuisema, but anayavuta hayo maneno. So it is time to call for help. So facial droop, arm weakness, speech or speech problems or speech difficulty, time to call for medical attention.
Right.
Yes.
That's a whole procedure you need to really
That's the process that you need to remember.
Okay.
The moment you suspect that someone may be having a stroke. Now, the trigger for that would be if someone suddenly complains of a headache. Sasa tulikuwa tu tunasimama hapa hivi tunapiga story ya first aid, tunaambia Wakenya kuhusu nini heart attack na stroke. Then uanze tu kuniambia I have a very severe headache. All of a sudden, from nowhere. And then I see that your face may be droopy and naona unaanza kuvuta maneno. Then probably the first instinct would be, let me try and do the FAST test on you. So I'll ask you to smile, I'll lift up your arms, I'll ask you a simple question that you can answer so that I can just test those three things. If you exhibit even one of those signs, then it is time to call for medical attention. Yes.
Right. Let's jump into eye injuries.
Yes.
And I mean, the eyes are on the face, and it's very common to have eye injuries because they're very susceptible.
Yes.
Either kitu imeingia ndani ya macho, you probably have a peck in your eye, or maybe even one of your eyelashes just in there. That's the whole mild when it comes to probably an eye injury.
Yes.
And then out to the whole extent, probably someone hit you, you hard surface hit your eye. Walk us through the kind of, let's say, common that as a first aider you've experienced, and how they can probably jump from a mild, something that you probably thought this might not get to the extent of being serious, but then it actually went overboard.
Now, when it comes to eye injuries, first of all, there are those minor eye injuries where you tell me that there's a speck or something in my eye.
Yeah.
If it is something in my eye or in your casualty's eye, the point or the aim is to try and get it out. So what we are going to do is try and wash it out. So I'm going to place your head under running water and wash it out, with the affected eye being lowermost. So nikitoa, then ask if you're okay and such. So
with cold water.
Let's call it cool running water.
Cool running
just
water.
Room temperature.
Okay. Apart from water, are there any other liquids that?
We recommend water because water is the one that will not have any effect on your eye. If you use any other liquids, you wouldn't know what kind of effect that it would have on a casualty. But water is just basic, you know. It already exists in your body.
I'm asking this because what on the street, some would say that breast milk would probably help in probably even removing, just helping.
The breast milk?
Yes.
Tutatoa wapi breast milk? Kama hapa. So anyway, what's it called? The recommendation is to get water, because water is readily available anywhere you may go. In terms of breast milk, I wouldn't probably advocate for that, because it is simpler to use water. Because the point is just to get it out.
And it's unaweza ipata just anywhere.
Yes, the point is to get it out. Yes, and it's easily accessible, and it's you don't interfere with someone else's privacy and basically what they're supposed to. You know, breast milk is for breastfeeding. It's for children. Unaitumia for specifically for that. So just use water, because it is readily available, it is convenient to use, and it has no effect after its use. It will just clean away the eye. The point is to clean the eye. If someone is bleeding, then now comes the dressing. So when we go through the kit, you will see that there is an iPad that we can use to place directly on the eye. Yes.
Because initially that was for the PEC. Then let's say there's a certain liquid that has entered into the eye. Do you also run through the same? For example, some plants that the liquid bit of it can enter the eye, and it can have a very inaanza kuwasha sana.
Yes.
Do you also do the same, running through the water and all?
Yes. Water is our recommendation when it comes to washing away foreign substances in our eyes and such. So be it a chemical or a plant, or even a venomous snake that has spat in your eye, we recommend that you wash it away with water for as long as it reduces the pain and it affects the person. So around 10 to 20 minutes is what we recommend, so that you can completely wash the substance away or out of the eye. Yes, and of course seek medical attention. If it was a liquid or something, go to hospital.
At this point, the casualty will have quite the temptation to rub the eyes.
Yes.
Is that recommended?
It is not. I know the reflex would be get it to the eye, try and rub it. Now, you pose the risk of causing further injury to the eye. So if you try to rub it and you cause further injury, then you're not really helping yourself. So I'd advocate for try and do not touch your eye directly, because you run the risk of introducing bacteria and such things. And also just use water, Tosha, but do not rub the eye.
All right. You're telling us about bleeding and how this can even affect, let's say, on either one or both of them. Walk us through again. I mean, how even the intensity, because well, as much as there's what we're seeing, but then inside pale ndani, there can also be even inside the eye. So, for example, a foreign object was probably lodged inside there. Walk us through how you do this.
First of all, if there is a foreign object, anything from a pen to a knife or whatever that is lodged inside the eye, the recommendation first is you do not remove it. If it is in the eye, build up padding around the object so that you can now dress it in place, but do not remove the object, because if you remove the object, you run the risk of even more bleeding, and that's what you're trying to avoid. So do not remove the object. Build up padding with any dressings, bandages that you may have. Put it along the foreign object, and once you do that, get the person to a hospital. if it is a head injury, sometimes you may see the eye turn color from the white to the red. Now, for that, you're going to manage it as a head injury, because if it is a head injury, you're going to manage the head, and with that, you just maintain an open airway. Yes.
Right. There's a quick question. So what if it's probably an aerobie fly that is inside your eye, and well, there's a possibility of it probably quote unquote or probably just releasing some of its toxins inside your eye.
Yes.
And the common recommendation that most people do is just blow air to the casualty. Does that help, blowing air into
you can blow whatever. If water is not readily available, you can try and blow whatever foreign object is inside the eye. You blow it out of the eye if you're able to. Again, maybe there's something that you had mentioned earlier about leaking inside your sifanye. So just blow it out if you do not have water readily available. Again, if you do have water readily available, that's always the recommendation. Yes. Right. And ensure that you just talk to your casualty, find out, is it better? Are they able to see? If they're developing blurry vision and such, it's probably something that has affected them, a toxic substance has affected them. They need to go to hospital.
All right. Any other takeaway on matters eye injuries before we start to open our first aid kits and take a look at, even for those that you've mentioned, when it comes to heart attack, stroke, as well as even for the eye injury, and you have this first aid kit, what is the first thing that you pick out? Do you just go and start picking out random things, do you say DA funike, or where exactly, and what exactly do you pick up from the first aid kit? Any takeaway for eye injuries?
For eye injuries, the recommendation is just, if there's a foreign object in your eye, wash it out with running water, and that should sort it out.
Okay, right. Yes. Fantastic. Now, tuingie kwa first aid kit. Uko na yako, mimi niko na yangu hapa.
Yes.
Tuone vitu ngapi ziko hapa, so I'll open mine and see what is inside here.
Yes.
There you have it. Tunaweka chini ndio.
Now, tuko na two sizes of first aid kits. This is what we call an occupational first aid kit. This is the recommendation for at the workplace. If you are a business owner or an employer, you need an occupational first aid kit at your workplace. Okay. This helps to cover around up to 50 people because of the content. Now, the content in this kit is similar to the small kit. It's just that the numbers are different. What is in the small kit is in the large kit. Maybe one or two things may not, because they are not necessary for the small kit. So this is the occupational kit. And then we have what we call the universal kit. The universal kit is the recommendation for the vehicle. If you have a car, you can use that. Or if you need one, and I would recommend one for the home, you can have the universal first aid kit. Again, if you have a large family, unaweza kuwa na watu 10 kwa familia. Tumia hii. Yes.
So because now you've explained it, and now people are curious what is inside here.
Yes.
Unaweza tufungulia.
Acha niwafungulie.
Sijui kevo tuweke juu ama tuweke chini. Hapo juu, hapo iko sawa. Okay. Unaweza tufungulia tuone.
Yes. So, tuacha nianze na hii, ndio alafu tuende kwa hiyo ndogo. Because hii sasa ndio iko na proper content, all the content. Sasa, first of all, kwa hii kit yetu tunakuwa na something, there's a list of items that are in this kit. Najua ziko huko chini, acha we'll get to them.
Okay, sawa.
Now, hizi tu ni funguo za hii kit yetu. Hizi ni funguo za hii kit yetu. Kama ni ya job, una need kuwa na mahali unaweza ifunga, but again ikuwe accessible to the first aiders on duty. I know most employers wanataka kuwa na kit ikuwe hapo, wafunge, alafu mtu mwenye ako na key hajulikani yako wapi. So unaona sasa the kit is there but no one has access to it. No one has access to it. So again, if you're going to lock it up, try and get make sure that the keys are accessible to the first aiders on duty at the workplace.
Okay.
Then hapa tunakuwa na hizi ni cleaning wipes. There is an alcohol pad and we have antiseptic pads. Hizi ni za kusaidia ku clean small wounds. If there is a wound that you need cleaned, so for minor injuries, kuna ile mahali tunatumia antiseptic, the liquid, ama spirit and such. Now this is already prepped. This is already prepped.
Because I remember there's a time you're telling me don't start using, let's say, some alcoholic drinks to start probably pour on a cloth and then wipe off.
Yes. So this is already prepped. If you have a first aid kit, you have an alcohol swab here. You have an antiseptic swab here. That helps to clean any wounds if you need cleaning. Sawa. So hii iko already hapo. So hakuna gati ile bottle ati ya spirit ama nini, hizi ndio ziko. Here we have a notebook. If it is at the workplace, you require a notebook to keep track of injuries and such things that happens to your casualties at the workplace and to the workers at the workplace. Here we also have hii ni saline water or salt water solution. Saline water is also for cleaning and for cleaning wounds. Also we have what we call a resuscitation mask. Hii ni resuscitation mask. Wacha kwanza tuanze na hii alafu tutaenda kwa hiyo. The resuscitation mask is when you're giving mouth-to-mouth resuscitation. This is a protective mask that you're going to place directly on your mouth. Sasa unapeana mouth-to-mouth.
Isikue lip to lip.
Isikue lip to lip. Hii sasa inakusaidia kujiprotect. So that is ziko kadhaa. Hii ukishatumia unajua una dispose, you can't use it twice. Most of the things when you use them here ni za ku replace.
Most of them. So there's some that
there are some that I will show you. There are some that you can use it again and again.
All right. I'm pretty sure this one has answered quite a number of questions that people always have. Mtu anashanga na sasa for first aid do I but then because let's say I do not have this, I do not have a first aid kit near me and I want to do first aid on a casualty and it necessitates a mouth to mouth. For example, this person has drowned. I'll still need to do the lip to lip direct contact.
What happens is that if you do not have this first aid kit and you do need to do resuscitation, we recommend that you do chest compressions only, without the mouth to mouth. But again, once you decide to give mouth to mouth, just know that they work together best. The chest compressions and the rescue breaths, they work together the best. But if it is not maybe your relative or your son, daughter, or whoever, do chest compressions only.
But then if it's a stranger, for example, and I do not know where probably the kind of bacteria this person, the casualty, has on the lips. So after the mouth to mouth, can I probably get something to probably rinse my lips or something like that?
Again, if it is a stranger, do not do mouth to mouth. Yes, do chest compressions only. Even if you have this, again, just do chest compressions.
All right. So
hapa tume-exhaust kila kitu hapo ndani.
Kulikuwa na
hii kitu ya blue.
Hii liquid.
This is saline water. Salt water solution. It is also for cleaning wounds and such. Medical, in terms of the healthcare professionals, kuna wanaitaga water for injection. Helps to deliver fluids and such things.
Sawa.
Kuna kitu ya blue umetoa hapo.
Kuna kitu ya blue. Naona pia kuna pen hapa ndani.
Pen ni ya take notes. Pencil.
Pencil na nini?
Take notes. Unajua tutakagi pen kwa sababu pen ina leak ink. Hiyo ni tweezers.
Tweezers
zinatusaidia kuhandle cotton wool, if you're using cotton wool, what's it called, gauze, to handle gauze and such things. Pick out splinters from your skin and such. Hizo tweezers zinatusaidia kufanya hivyo.
Right. So hii kitu ya blue sasa tumeifikia. Acha hii niweke chini. Yes. So this one.
Hii kitu ya blue ni tourniquet.
Tourniquet.
Yes, a tourniquet.
Elezea tu wa Madhare pale na Kayole na huko.
Ushaidungwa sindano hapa. Si ushaidungwa sindano hapa. Kuna kitu ufungua hapa hivi. Hiyo ndio inakuwa tourniquet. Inakuwa kazi gani? Inakuwa so that you can make the veins prominent and such. Ndio. Now kwa first aid, the tourniquet helps to reduce what's it called, bleeding. Any bleeding in the arms or in the legs.
So there are quite a number of them here, so you kama because tuko tuna brush through them here.
Haina shida. Kuna gauze, hizi ni madressings za kuweka kwa wound and such things. Hiyo ni adhesive plaster. Ni ile yenye Wakenya wamezoea kuita Elastoplast. Elastoplast ni brand. So it's just adhesive plaster for small wounds and such things.
So how even necessary is this? Because we, as you're saying, hata kwa nyumba nitakuwa tu na hii, just a bunch of them. You probably buy them and just stock them, just in case you have a minor injury, kuna katakata nyanye, something, and you cut your finger. And you run very quickly, and you
first you clean the wound. Once you clean the wound, you place that adhesive plaster there on the wound. Unaiacha, it prevents bacteria and what to getting to the wound, prevent infection. Of course, pia unaweza change regularly in case the wound hasn't healed completely. But that's for very small wounds.
So we have this one.
Hizi ni gauze za ku-clean na ku-cover as dressings. Now, there's something that I told you that you can use and reuse. Hii ni hot or cold pack. In case you have swelling, this is iko na instructions. When you want it cold, it has instructions. It has instructions here. How to make sure that it goes cold. And then for it as a cold pack, it's for swelling. If someone has a swelling somewhere, maybe akona sprain, akona fracture, na una need your swelling reduce, unawekelea your cold pack. Now, for it to be a hot pack now, iko pia na instructions hapo maliweka kwa microwave and such, ama kwa maji moto, and you use it. Now for a hot pack is where you require heat. Where you require heat.
And it says immerse the gel pack for approximately 4 to 10 minutes.
Yes.
After 4 minutes, check after every 1 minute to see if the correct temperature has been reached. Now that's for the hot one. For the cold one, store in the freezer so that the pack is ready to use in case of an injury.
Yes. So those are the instructions on using it. So you can have one or two. One for hot, the other one for cold. Yes.
So this one can be reused.
Yeah, you can reuse it. And then this is an emergency blanket. This is what we call a thermal blanket. If someone is going into shock and you need to keep them warm. Inakuwa gani kubwa? Hebu soma tu dimensions zake.
Ndio nimeona 130 by 210 centimeters.
Yes.
Wow.
So ni kubwa. When you open it up, it covers the whole body. Covers the whole body, it keeps you warm. Inafanya kazi kama hot flask ile ya maji moto na nini. So it helps your body is already warm. So it helps to retain that heat.
So in lemon stamina ni blanket ndogo imefungwa
hapa ndani. But for first aid. Mtu hawezi tumia for their day to day because ita overheat. Unaweza ukikaa nayo for too long utapatwa na kitu inaitwa heat stroke. If it is not for someone who needs it, then you shouldn't use it. If you're able to regulate your body temperature naturally, usitumie hiyo.
Right. So that's a rescue blanket, quite a huge one, huh?
Yes. Hapa sasa ndo kuna hii iPad. Unaona hii iPad ndio we are talking about the eye injuries. Hii unaweka kwa jicho. Hii unaweka kwa jicho, it helps to now reduce any pain that the casualty may be having. So there are a number of them.
And interestingly, just behind it, there are What are this?
It's only tape.
Oh, okay.
Adhesive tape or first aid tape.
Right.
It's for holding the iPad in place or any other gauze in place.
In place, okay.
Just to stick to it. Inafanya kazi kama sellotape.
All right. Pia ndani there's also scissors, okay?
Yes, hapo kuna scissors. And then here we have now, these are triangular bandages. Triangular bandages ni zile, on previous shows we've been tying slings and such things. So this is how they are packed. These are triangular bandages for tying slings, for securing dressings in place and such. So, and for applying pressure to wounds and such. Right. So that's what this triangular, but they are ziko kadhaa. For an occupational first aid kit, zinakuwaga mob. Hapa pia kuna kuwaga na
zingine nyingi hapo.
Hizi ni mingi. These are just dressings. These are wound dressings. In different sizes and such. So if you have especially major wounds and large wounds, you can use this. Zinakuwaga mob sana hapa.
So zingine zenye ziko nyingi hapa ni hizi ndogo ndogo, some elastic.
Hiyo inaitwa creep bandage. Creep bandage inatusaidia ku secure joint. If you get twist maybe on your wrist or your ankle, there are different sizes now for securing that. This helps to apply pressure on joint injuries. These are for joint injuries.
So a quick one, let's say this occupational kit has been used for quite a long time, and this bandages, zikaisha, and then you just had these ones, and it was probably just for dressing a wound. You wanted to dress a wound. Can you use these ones instead?
Again, the way these are designed is you can put them directly on where bleeding is. But for this, it's for securing it. So you can use this together with gauze, this sterile gauze.
So you can use this one and this one?
Yes.
Okay.
To do this work.
Okay. So you use the gauze on top of the wound and then you wrap.
Yes, you wrap the creep bandage there.
Okay.
You can do that. Or even a clean piece of, like a, what's it called? Handkerchief. You can use it directly.
Okay.
Shida hii creep ni, ikona nini, some movement, inaweza stick kwa wound.
Okay. All right.
Hapa tuko na thermometer.
Okay.
Digital thermometer for taking temperature.
Kwa umbali nimeona ni kitu ingine. Sijui kama unadhani ni kitu nimeona but oh yes. It looks like a pregnancy kit. Yes. Makosa ni yangu.
Any thermometer. That's just for taking temperature. Normal body temperature should be around 37 degrees Celsius. So that's, if you find that someone is a bit too hot, take their temperature using that. Inakusaidia kujua whether this person is okay or not. They are running a fever, their body temperature is below normal.
So but a man's not hot. Yes. So next up.
Hapa tunakuwaga na, these are Ziploc bags. Unaona hizo dressings na magauze zenye unatumia. When you need to now dispose of them, you put them in these bags. You put them in these Ziploc bags, so that now you can dispose of them as medical waste in a medical facility. Usizitupe tu kwa dustbin kawaida. That's for storage. Alafu sasa hapa hizi vitu mingi zenye unaona hapa ni cotton balls. These are just cotton. Unaona kuna ile inakuwa one large piece of cotton wool.
Chuna.
But sasa hii hakuna kuchuna, they're already prepared. So they are in ball forms, but ni cotton wool tu bado. Hapa kwingine, what I have left, I hadn't mentioned, there's a time, kuna swali uliniuliza, what's the first thing you take out of your kit? Gloves. The first thing that you take out of your kit when you're handling a casualty
is the gloves.
Is gloves.
So far nimejaribu learn how to wear them.
Yes.
Unaingiza yote alafu.
The point is to wear them. Bila hizo kufanya nini? Kutoboka. So there are quite a number of gloves here. These are the kinds that are found in our kit. This is already pre-packed in pairs. So this is just one pair. Ziko kadhaa.
Okay.
So now there is something here in our kit that shows you. It gives us 5 ways in which you can save a life. It has a few conditions here that it helps to remind you what to do in case someone is choking, what to do if someone has been burnt, what to do if someone is having a heart attack, what to do if someone is unresponsive, what to do if someone has is bleeding. Those are just ways in which you can, it reminds you basically. That just tips on first aid.
Ndio hapo kwa screen unaweza baiba notes, a couple of them. You might probably need them today.
Yes, exactly.
Ziangalie baiba notes vizuri.
So this is always part of this first aid guide is always a part of your kit.
Right.
Hii sasa is a complete list of the items found in this kit.
That are in there. Okay.
This is a complete list of items. This is a checklist. The moment you use something,
32 items here.
Yes. The moment you use something,
like
una indicate hapo hivyo. So kama ni dressing umetumia, una indicate that dressing size zilikuwa 100. So we need to maybe inafika point where you need to replenish your first aid kit.
Some 32 items there. They also tell you the quantity in each item.
Yes. So basically, that is the content of our first aid kit.
Okay.
There's something we call a trauma pad here.
All right.
Hii trauma pad is for severe bleeding. This is for severe bleeding. Ukiona mtu akona excessive bleeding, enye this kawaida dressing won't work. Use this. It's much thicker and helps you to absorb more blood.
So, for example, if it's a very deep cut that someone has, you'd go for this one.
Yes.
So this means even if you have this one, having a first aid kit isn't enough. You obviously need to know what each of these 32 items they use.
Yes.
Because I probably have this one, and then I see someone has a very deep cut. So real quick, I'd probably be running for this one and using, let's say, 10 of this, just to ensure that nifunikio damu vizuri. Kumbe ningekimbilia.
Yes. So it's always just be familiar with your first aid kit. What is the content of a first aid kit, so that we know that in case of this kind of injury, this is what I need to do, and this is what I need for this injury. Unaona hata kama creep bandage, unaona kama hii creep bandage iko in different sizes.
Okay.
If you find someone has an injury at the ankle, probably this won't work. This is for the wrist. So you need a bigger one. You need a bigger one. So that's basically what this first aid kit is about.
Because I'm trying to think. Someone is here injured, probably you have one or even a number of casualties.
Yes.
So the amount of time you need to even think that this is probably a deep cut and this is the exact item that I need. Because I mean, we were just ravaging through the kit and looking for one specific item. So you really need to be very quick when it comes to how you react. This is the casualty, na ndio uonda konayo or something, and this is the exact item that I'm going for in the kit. Again,
these items are interchangeable. Vile tu nasema, unajua kama hii ni dressing ya kudeal na bleeding, you can be using it meanwhile as maybe someone is looking for the trauma pad or something. It's si ati ni ya must kutumie hii. It's just use it for whatever it is that you have. Maybe hauna hiyo dressing, you can use gauze and vile tu tumesema gauze na crepe bandage.
Right.
Yes.
So this one has the occupational first aid kit has 32 items in it. You umetuambia ni about that can serve about 50.
Yes.
50 around averagely 50 people in an office or somewhere. Mali kuna watu wanafanya kazi or a public space.
Yes.
But then now you have this one which is smaller, could be at home. So how many people can this one serve?
Up to 5.
Up to 5.
Yes.
So this is a family kind of a setup.
Yes.
Ama ka ofisi kadogo yenye kuna watu watano.
Kama mko na watu watano kwa ofisi unaweza tumia hii.
So how many items are here?
It's the same number of items.
32.
It's the same. No, hizo 32 items. Maybe what is not here is things like the trauma pad, because you won't have probably serious injuries huko.
Hii hot and cold pack iko hapa?
Hot and cold pack iko. It should be here. It's somewhere here inside ndo hii. Hot and cold pack hii. Unaona hata thermometer iko. Ndo hii hot and cold pack hapa. So all these items, it's just that the numbers are less. Hapo unapata kuna triangular bandage kama 10, hapo uko na 2. Crepe bandage hapo hivi unapata uko na 6, hapa hivi uko na 2. Gloves hapo hivi uko na pairs kama 10, hapo uko na pairs 4. So the same items that are here that are here are here.
So how about restocking? So if I want to, let's say, restock, if you're saying I have 2 pairs of, let's say, the cotton balls, and by 1 month, all of the 2 are used up. So do I, when I'm restocking, do I go to buy specific items and restock my first aid kit? How does that happen?
You have that option. You can restock the same items. Kama ni cotton wool unataka restock, just come. St. John Ambulance, these things are available at St. John Ambulance. Come and say, I need maybe adhesive tape, I need gauze, that's it. And also, there's the option of now replacing everything. Mostly at the workplace, maybe if you haven't used this in a while, these things expire after a period of time. Kila kitu kona expiry date yake. Kila kitu kona expiry date yake. So at some moment you will need probably to replace all of them.
What's that one item in this kit that really needs frequent restocking?
Ni ile adhesive plaster, ile elastoplast. Unaona hizi watu wanatumiaga sana. So you may need to replace it all the time. Na pia hii inaitwaje? Hizi alcohol swabs. These ones are used very, very often. Back at home, I hope all about the first aid kit, what is inside here, the 32 items there, and even how to restock it and how important each and every single item here is. Before tumalize, naona t-shirt yako imeandikwa Save a Life Walkathon. Tunatembea tukienda wapi? Tunatembea tukiraise funds. We have the annual St. John Save a Life Walkathon on 8th of June.
That's next week?
Yes. So itakuwa pale Kenya Railways grounds, inaanzia hapo, and we have 5 kilometers, 10 kilometers, 21 kilometers. You are able to contact us on our numbers. You can call us 0721 611 555, 0721 611 555 to register for the walk. And a t-shirt kama hii unaweza get na 1500. Ukitu contact, book, you want the 5K, you want the 10K, you want 21K, that's up to you.
So do I pay for the walk plus a t-shirt, or
once you register for the walk and do the what's it called, buy the t-shirt, you register now for whatever distance that you want.
So the fact that I have bought a t-shirt is automatic that I have registered?
Yes.
Okay.
So now you can register now for the distances.
1500 is same
for an individual.
For all kilometers.
Yes. And then sasa kuna zile za corporate sponsorship and such. If you want for a number of people, you can always contact us. Yes.
All right. Remind us again, so from Railways bus station all the way to?
Not Railways bus station.
Railways.
Kenya Railways headquarters grounds.
Kenya Railways headquarters. Okay.
Kenya Railways headquarters grounds. We go along Haile Selassie, Mombasa Road, and Nyayo Stadium. Tunatembea. So for that distance along Mombasa Road and we're back.
Okay. How many people are you expecting, probably? Because I mean, taking a look at it is CBD and all that.
We're hoping like 4,000 people will show up.
Wow.
Yes, that's the expectation, around 4,000 people.
Why should someone register? Any kind of specific activities that they should come to, apart from the walk?
What we are doing, we are raising funds for training community responders. Unaona hii first aid tunafanyaga hapa hivi. We go out in the community to do that. So that's the main activity. And of course, now during the walk day itself, kutakuwa na activities for the youth in terms of aerobics, small competitions for the particular day. But the main agenda is the walk to raise funds for training of community responders and community first aiders. Yes.
And as first aiders, because you really deal with matters blood a lot, and someone is might be very curious. Is there going to be any activity on blood donation on that day?
On that day particularly, no. On blood drives, maybe later on we can organize. We're going to go organize for a blood drive. But this specific day, is for those activities, targeting community responders and first aiders. Yes.
Expect ianze saa ngapi hivi?
Asubuhi 6 am.
6 am mshaanza.
Una report tu pale hivyo by 6 am tuna register, we flag off, tunatembea hapo hivyo, hopefully by maybe 1 o'clock we should be done.
Right.
Yes.
Can probably, before I get your last thoughts, someone will connect after pen and the number.
Yes.
You can remind them the number, then give us your final thoughts as you wrap it up.
Our number is 0721 611 555. 0721 611 555. Yes.
Thank you very much. Any last thoughts?
Buy yourself a first aid. Yes.
I love that one. Thank you very much, Andrew Njohi kutoka St. John Ambulance. You've got the number in case you're really interested. On the 8th of June, tembea kuja hapa Nairobi, Kenya Railways. Kenya Railways headquarters grounds. Yes. All the way. Kutembea tu hapa hivi Nairobi pole pole, usiseme hujui town pia. 1500 bob, get a wonderful t-shirt kama hii, mimi nitatafuta hoodie. Pia. I'm yours truly, Stanley Nyerungita. Asante sana for being with us from 6 a.m. to 10 a.m. This is how we kickstart your week with a marvelous kind of a week. We're with you all the way to Friday for fantastic Friday. So stick around right here. Always talk to us. On behalf of the entire team right here, have yourself a marvelous Monday. Kwaheri.